Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to give a brief overview of Polycystic Ovary Syndrome. Polycystic Ovary Syndrome is a collection of findings that are linked together. In fact, any syndrome is a collection of findings, clinical findings that describe an entity that we don't necessarily know the cause of. So we don't really know exactly what the cause is, but polycystic ovary syndromes includes a tendency to have a problem with your weight for a woman, a tendency for irregular periods, a tendency for acne, a tendency for dark hairs, facial hairs, and also hairs between your belly button and your pubic hair, a tendency for acne, a tendency for diabetes in the family, and a tendency for multiple small little cysts on your ovaries, and maybe not a tendency to not ovulate often and a decreased chance of getting pregnant without assistance. Putting all those together, this can be an issue with controlling your periods or trying to make a family or controlling your weight. You can see that there is a separate video I have on polycystic ovary syndrome and getting pregnant, and also polycystic ovary syndrome and weight loss. I won't get into those details here. Years ago, we used to do some hormone levels with a ratio of FSH and LH. Those ratios have not been shown to be of so much value, so we rarely do those. If you have those findings, you might need other tests to figure out what's going on. But generally, if you have that syndrome and you're not trying to get pregnant, a reasonable treatment might include oral contraceptive pills to give you better control of your periods, and a regimen of weight loss and exercise that can be helpful. You may or may not get a recommendation for metformin, which is a diabetes drug that might be of help. It's especially useful if you're trying to get pregnant. That might be of use in addition to other fertility medicines like clomiphene citrate, Clomid, or letrozole. You might have heard those words. If you're trying to get pregnant, you might need some progesterone, you might need those medicines, you might need metformin added in. The details of those use are things to bring up with your physician. Suffice to say, if you have some of those symptoms, you might discuss it with your physician, find out that you have polycystic ovary syndrome, and know, okay, I need to take some steps while I'm not trying to get pregnant, or some different steps while I'm trying to get pregnant. So I hope you found this overview of use, and refer to my other videos. Please leave your comments. Thank you.